Across the nation, the number of COVID-19 cases and hospitalizations continue to drop from record highs during the height of the Omicron surge. Despite the declines, there are rising concerns about states' move to ease restrictions too soon. Dr. Adam Brown joins us now from Washington, D.C. He's an emergency physician. Welcome back to BNC Live, Doctor. I want to start with these reports of a possible fourth COVID-19 shot. Does the data show that this is necessary?
Well, first, let's be very clear. So there is a segment of the population that should be getting their fourth dose of the vaccine or fourth booster. That is those who are immunocompromised and high-risk populations. The CDC came out in early January to make that recommendation. But for the general population, CDC has not made that recommendation yet. So you ask about what some of the data is showing. There is some mixed reports out there. In some of the studies that we've seen coming out of Israel and out of the United Kingdom, there has been some improvement that's been seen with a fourth dose of the booster, but there's been some others that have shown that it didn't really change the efficacy that much because of the type of circulating virus that we have now, that being Omicron. So what we're hearing is that the CDC may come out a little further into the year, especially as we see what happens with this Omicron wave, to recommend a fourth dose of the vaccine.
And right now, 65% of the nation is vaccinated. But how are we going to get everyone to a fourth shot when there's actually still people holding out on getting their first two doses?
You bring up an amazing point. And I think it's oftentimes missed when we talk about a fourth dose because, as you mentioned, 65% of the population are, quote, fully vaccinated, meaning having two shots. We know that the vaccines do reduce hospitalizations and deaths. And so we're going to have to take a much more concerted approach, getting into communities, having those tough conversations to get people vaccinated. From a booster perspective, less than 30% of the population is boosted. And we know that during Omicron, if you were boosted, you had a lower chance of hospitalization and death as well. So I think we're going to have to really focus on getting a big portion of the population vaccinated who's not been vaccinated and boosted, because vaccines are going to be a part of the way that we combat this disease. And if we don't identify the means and methods for talking to those populations who are unvaccinated or unboosted right now, and to get them to get those vaccines, we're going to continue to have new variants. We're going to continue to have significant strain on the hospital systems. And of course, unnecessary deaths.
Which we don't want, of course, unnecessary deaths. But here's the thing, doctor. There's so many different messages out there. People can't even really figure out, do I need this shot, that shot? Do I need a booster? Do I not? Can I mix them? I mean, when are we going to get some type of official word on this? Will we get it? An official recognition about, yes, you must get booster shots, or this is what's mandated. It really feels like we're getting a lot of information, but it doesn't seem official. It doesn't seem like, well, you need to, or you have to, or here's why. It's just a whole lot of, now you might need the third boost. Now you might need a fourth boost.
Yeah, that's also another great point there. The message has been muddied, and there have been times that I believe that the CDC, while trying to adhere to the details of the science, as we always should, sometimes are not recognizing the reality and importance of conveying a very clear and concise message to the public. But I do want to caution folks as well, before pointing too many fingers. We are watching this virus evolve. We've gone through multiple waves of this virus, and with each wave, we've seen changes in the way that it acts and its ability to infect people and the severity. That's also changed the way that the vaccine has had to act with the human body. And so that's part of the reason why we're watching in real time an evolution of the virus and having to shift and change our message. So while frustrating and while challenging for people to receive that message, it is necessary because the virus is changing, which means we are going to have to change with it. But with time, Laverne, I do believe that we are getting better understanding of how this virus acts and how the vaccine acts with it. And with that, we can have more clarity in our message. But I want to be very clear for everyone today. We've got to get people vaccinated. We've got to get people boosted. And if you're over the age of 5, you can get vaccinated. And that's going to be a critical piece to the puzzle of helping us get out of this pandemic and start to live with this virus.
All right, Dr. Brown, thank you so much as always for updating on all of this information that's out there. You're very helpful in making us understand exactly what's critical and what's not. Appreciate your time. Well, this is a critical time in the year when it comes to sticking to those resolutions you set on January 1st. Remember that? Well, think about it because today is actually February 22nd, the year 2022.